Everyone. Welcome back to the DNS podcast. Today, we're discussing a novel hands-on approach to professional development for dietitians, an Enteral Nutrition Skills Lab designed to build confidence, foster collaboration, and strengthen practical competencies in enteral nutrition care. This interactive event brought together clinicians, educators, and industry partners for a unique experience that blended product exploration, tube-feeding practice, and interdisciplinary learning. Participants gained a deeper appreciation for what patients experience while also enhancing their technical and clinical skills. Joining me today are Jeanna Rich and Gabby Haskell, two exceptional dietitians from the OSF Cancer Institute in Central Illinois, who co-developed and led this event. Jeanna is a registered dietitian and board-certified specialist in oncology nutrition with over 13 years of experience supporting patients across the cancer care continuum. She has developed numerous educational programs, webinars, and workshops designed to advance oncology nutrition practice. Jeanna is passionate about all aspects of enteral nutrition, particularly advocating for patients and improving processes from pre-placement planning to successful home initiation. She shares her knowledge in a variety of ways, including service on state and local nutrition-related boards and committees. Gabby is a registered dietitian in oncology nutrition, also working at OSF Cancer Institute, where she provides evidence-based compassionate care to patients throughout their cancer journey. She specializes in enteral nutrition support and feeding tube management, helping patients maintain strength and quality of life. She is also the president-elect of the Central Illinois Academy of Nutrition and Dietetics and was recently named the recognized Young Dietitian of the Year by the Illinois Academy of Nutrition and Dietetics. Together, Jeanna and Gabby are redefining how dietitians learn, collaborate, and build hands-on confidence in enteral nutrition.
Coming to you from the Dietitians and Nutrition Support Dietetic Practice Group, this is the DNS Member Podcast, where we explore topics relevant to our field. From support line content to nutrition celebrity interviews and everything in between, this podcast is where DNS members can go behind the scenes and explore the driving forces behind cutting-edge nutrition support. I'm your host, Christina Rollins. Let's get started.
Well, Gabby and Jeanna, thank you so much for joining us today on the DNS podcast. I'm so happy that you're here.
Thank you so much for having us. We're so excited for this opportunity.
Thank you.
So can you start by sharing with us what inspired you to develop the Enteral Nutrition Skills Lab at your institution?
Yes, so we first heard about a dietitian skills lab from one of our Cape Farms rep through just talking about what other things we could connect with throughout the year. And they talked about a hospital in Indiana that did this. And she shared that they brought together a bunch of dietitians just to learn more about enteral nutrition, fine-tune some skills. And after Gabby and I heard this, we absolutely knew we had to host one ourselves. We love anything hands-on, so we immediately wanted to know what all this entails, how can we do it? We actually often see how many dietitians, especially in clinical practice, feel unsure or anxious about managing the hands-on aspect of enteral nutrition. And this is something we actually love about the scope of a dietitian. Some dietitians have not even touched a tube or even thought it was actually part of the scope of practice. We've always been more hands-on and advocating for that role. So to put together something like this was just fun for us. It was something we wanted to take on top of our regular role, and we thought it would bring a lot of fun joy to other people. We wanted to teach people things like how to educate the patient on how to physically perform the tube feedings themselves, troubleshoot pump issues, and feel confident to talk to other DMEs about coverage issues and advocating for your patient when needed. And most importantly, we wanted to create that really safe space where dietitians could practice the skill in a realistic but very low pressure environment where it was okay to mess up while learning.
So when you are thinking about how you currently train dietitians, kind of comparing that to this idea, what were some key educational gaps that you identify that you were hoping to fill with this experience?
One of the biggest gaps that we noticed was just lack of hands-on experience. I think for both of us in our undergraduate and then graduate degrees, we just noticed that there wasn't a lot of hands-on. You do lots of calculations, your face is in a textbook and a computer, and we really felt that hands-on aspect was lacking. So we wanted to bring this to the dietitians. I originally came from an inpatient setting, and when I started off in my job, I didn't know what to do with a tube feeding pump. I didn't know what to say when a patient had questions about their feeding tube. So we really wanted to address those barriers and bring all the dietitians together to understand that there is more to our scope of practice than just knowing certain disease states or calculations. We wanted to bring them together, have them touch a gravity bag, use a syringe to do a flush. And we felt that a lot of people had a huge takeaway from this experience and just left with so much more confidence being able to answer those patient questions that might come up.
And I also think we saw a really big gap in how to communicate with the other interdisciplinary team members, right? So working with the home health nurse on checking in on your patient tolerance, et cetera, working with SLP and providers. But one thing as a dietitian, I never thought I'd have to learn was insurance. So how to work those big gaps, like who teaches you the difference in insurance and how to diagnose and code and all these other variables that you learn on the job. So if we can get a head start in teaching this to others, it will only better serve the patients and their outcomes.
So how did you structure the day of training to really balance learning, networking, and the hands-on experiences?
So we started our skills lab off with a half an hour of networking prior to the start of the event. So that was optional. We allowed the dietitians to come in, greet each other because we had inpatient, outpatient, peds. We had dietitians that drove over 2.5 hours to come to this event. So we were just floored and so excited to meet them. They had appetizers, refreshments. They got to walk around to some of the different companies that we had present. They were able to visit plant-based enteral formula tables, blended formula tables, a DME table that had pumps. We had a viscosity table where you were able to test the viscosity of different blended formulas. So they really got kind of a full-rounded experience to start off.
And then it was kind of, we thought through, we wanted it to almost be like if you've ever gone to a conference or symposium, you have that connection time, that vendor network time, and then you sit down and kind of do the nitty gritty. We wanted the first year to start off with the basics. So honestly, some dietitians have never seen what the syringe looks like to flush the tube. So at each person's station, we had a syringe, we had a gravity bag, we had some water, and we just had them touch the syringe, take the plunger, push and pull it, get used to feeling that. And then we had them partner up and do a gravity bag feeding with them. And so it was amazing to watch, like their eyes kind of be in awe, get to play with the items. We then had a education from one of the medical liaisons on how to do feeding intolerance triage. And then we also had the nurse educator from the GI lab come in, talk through how a tube gets placed, why it gets placed, all the nitty gritties that go into the placement and post-placement care. And then we also had them kind of do like an open panel discussion. And then we kind of talked through some other modular and insurance issues and had a pump education. And so we crammed a lot in a 2-hour time span. But the first year we absolutely wanted to kind of start from square one and build upon that.
Talk with us a little bit more about how you landed on having the GI lab nurse educator present that information versus having a dietitian, so a peer, present it. Like, how did that enhance or change the learning experience for your attendees?
Yes, so the nurse educator we partner with, we learned a lot from her ourselves regarding outpatient tube placements. And so we wanted to have her bring that to our eyes. So what we don't see that goes on behind the scenes, what goes into prepping the patient, the meds that they do, what the procedure looks like. Because as dietitians, we get asked all these questions when we recommend a feeding tube. The patient will want to know, well, what all does that entail? I don't know. Let's learn, right? And so, are you anesthetized or not? And so, really bringing her in just really it paints the whole picture of what that patient experience is going to be because it can break a lot of barriers of fear when patients think that this is a huge undertaking procedure. And I think one thing that Gabby can touch on is that our nurse educator really helped walk through that after site care and the new type of guidelines that our facility implemented.
Yeah, the GI nurse educator talked a lot about buried bumper syndromes. This is something that GI doctors are seeing happen with 4x4 gauze pad placement. And so she was able to tell all of these different dietitians about it, educate it, so then we can go on and educate our patients and prevent them from having to have their feeding tubes placed very frequently. We felt having her there really identified big gaps in care and just really emphasized the importance of interdisciplinary communication.
So, how did you choose which products and devices to include for that hands-on experience? Because we know there's a lot on the market. So, like, how did you pick what was going to be there? And then how did the participants kind of respond to that element?
We had a really hard time kind of narrowing what we wanted to focus on. We felt like a lot of us had a pretty strong knowledge of the standard polymeric formulas. So we wanted to go beyond that and do some unique enteral formulas that you might not necessarily see in a hospital setting. We focused a lot on plant-based formulas because we know that this can benefit, many populations, diabetes, renal, oncology. So we really wanted to kind of focus on that. We also included peptide formulas. Those are becoming very popular nowadays. And so the MSL was actually able to kind of touch on the benefits of like a plant-based and a peptide formula, walk everyone through that, talk about the indications where it be necessary. But we also had some different oral supplements too, like high calorie MCT based supplements. We had different, protein modulars. So we tried to have a little bit of everything. And we felt that the participants took it really well. They were like, oh, I've never seen this product before. Let me learn more about it. How do I get this for my patients? So it was amazing.
And I think in a time where enteral nutrition is becoming where very patient centric and really listening to the needs and people wanting to make healthier choices, it's really important for us dietitians to be aware of all these options. Because even if your hospital only has certain options on formulary, maybe your patient's coming in being on something that you're not familiar with. And now you'll have some um, ability to identify this type of formula, the pros, the cons, and how to bring what you can and meet somewhere in the middle. And it also allowed us to just stay ahead of all these new products and make contacts as well with their reps to continue to learn more and promote this with the care that's going on in enteral nutrition.
So, were there any like aha moments that stood out when your participants were really like learning the gravity and syringe feedings themselves? Like, did anything jump out at you at that point?
Yes, I think one thing that was really funny, and it totally, I hear it with a lot of my adults, older patients, was how hard it is to pull the plunger from the syringe. A lot of them, they were like, "Oh gosh, this is actually taking effort." And so we talked through exactly if we have a patient with ALS or poor hand grip strength or just poor hand functioning, right? Like that's going to be a challenge. We need to consider maybe other methods of feeding. Um, and that was just really cool to see. And also the gravity bag drip, watching them kind of control the drip and be able to slow it down, but also see, oh wow, that if at a slow rate, that is not very fast. And we get so worked up sometimes with our calculations being 5 mLs faster than what we wanted it to be. And so they were able to kind of really capture that full picture spectrum.
Exactly. I feel like the participants were able to see how those small changes in technique, like, oh, if you hold your syringe and your feeding tube all the way up here versus down here, just different things like that can make a really big difference in overall like enteral care. And so many of the dietitians told us, I feel so much more confident now that I've been able to learn these things, triage these questions, and now I feel confident in the care that I'm providing to my patients and their families.
That's wonderful. I mean, I think that's probably the best outcome you can hope for, right? When you do something like this. Very cool.
Yeah, absolutely.
So you mentioned earlier about the durable medical equipment and the pump training and how so many people haven't ever done that before. And I would venture to say there's probably people listening who don't even know what DME means, right? Like that's just not something that is in everyone's vocab. So talk to us a little bit about that and what were some of the key takeaways regarding DME and pumps?
I feel like that area of the lab was maybe one of the most important parts because we had dietitians coming from the hospital who say, I see those pumps every day, but I've never actually touched one or programmed it. So they were able to actually walk up, work with one of the DME representatives who was a dietitian herself, which I think really helped, and learn, okay, this is what I do if I have an occlusion in the line. This is how my patients are actually setting their pump up. This is how you flush water through the pump. We get calls from patients all the time. My pump is beeping at me and it's making all these weird noises. What do I do? And I think typically we're like, oh no, what do we do? So this really gave us the confidence to learn how to deal with those pump issues. And obviously, there's many, many, many types of pumps out there. But I think for us to just be able to sit there hands on and see what our patients go through every day, and see, how our recommendations play out in real life hands on was so amazing.
And I also too think the pump was really eye-opening that they learned that it can be portable, right? And that there's other methods besides the pump as well, like including like free arm and bully bag. And so we had that there as well. But I do think that it's taking a minute to learn that jargon, like you said, and then also just doing it once yourself automatically enhances that confidence when talking with a patient. Absolutely.
Well, we know that another aspect that further complicates the care we provide is, adequate enteral nutrition orders and then also insurance, right? And again, we're not taught about insurance in our dietetics training for the most part. So how did you kind of attack those real world challenges so that people could walk away and really feel like they could confidently provide that holistic care for their patients?
Yeah, so Gabby and I really pride ourselves on being able to fight hard to get things covered. And we've learned a lot over the years, and it's just been through trial and error and self-taught. And so we kind of built kind of example statements of what to put in your documents or have your providers notate if it's applicable to your patient. But it's really pulling in different pieces about the patient and putting together that really nice, hefty piece of documentation to promote and advocate. And also teaching them that just because you got no once doesn't mean it's a no forever, and to ask why it was declined, and then if it's for something that you can get covered, to add that into your documentation, because a lot of the times the people we're sending these to are non-dietitian or non-healthcare folks, and so they're just going by checks and balances. And so it's just learning how to really capture the patient issues and put it into words to advocate for coverage. And then we also walked through like how there are some stipulations between Medicare and Medicaid, percent PO versus enteral. If you need a protein modular, make sure you document that there's muscle loss. So kind of like a flow sheet was built out. And I think that's something we plan to expand on and do like case studies on, and even enhance our flow sheet of if you want this covered, you have to have X, Y, and Z documented. It's stuff that Gabby and I have put together throughout the years and just want to just enhance that learning for everyone.
So do you have any more skills labs planned in the future? Like, will you be doing this again?
Yes, we are supposed to be doing it this upcoming year in 2026, and we are so incredibly excited. We took the feedback, the positives, the negatives, and everything, and we want to expand it next year, make it even bigger. We got the go ahead to expand it to other dietitians outside of our hospital organization. So we are just so excited to see where this goes, and excited to expand our reach and help other dietitians out.
So, just with our couple of minutes left in this episode, what advice would you give our listeners or institutions for that matter who are interested in creating their own skills lab related to enteral nutrition?
Absolutely. I would say identify those real world gaps that you see that you incur every day in your career. So there's certain things, that might frustrate us. Oh, this is so hard. I keep getting denials. I don't know the answers to this. Jot those ideas down because chances are other dietitians are having those same problems as you, and create a safe space where practitioners can go and not feel, dumb for asking certain questions. We wanted to create a safe space where no question was a stupid question, and we were all able to walk away learning so much from this event.
And don't be afraid to include other healthcare members because it is so awesome to see other people that want to come. Some of our nurses and home health nurses and SLPs want to be a part of the next event because they want to learn, but also share their knowledge with us. And they want to be cohesive. So you will be shocked at the support that you will get. And also, there's so many unique ways to do this. I know some facilities do it as part of their tiered ladder through their hospital system. Some are CE based, some are not. And so you can really jazz it up and make it what you want. It's such a flexible yet instrumental learning activity.
Awesome. Well, thank you both so much for being here with us today and for all you're doing to advance our field. I think this is just one really awesome example of how novel training ideas can make us all stronger together. So thank you so much for what you're doing.
Thank you for what you do as well.
Thank you for having us, Christina. This was so great.
And listeners, I do want to take a moment to do a shout out. If you enjoyed what you heard today and you're looking for more opportunities to hear Jeanna and Gabby share their expertise, they are presenting at the Illinois Academy of Nutrition and Dietetics Annual Spring Assembly. This event will take place on Friday, March 20th and Saturday, March 21st, 2026 in Naperville, Illinois, so just outside of Chicago. They'll continue to share their knowledge through a presentation entitled Advocating for Enteral Success, Expect the Unexpected, and I'm sure they would love to have you join them there. Registration opens soon, so we will be sure to put a link to that page in our show notes. Until next time, I'm Christina Rollins. Thanks for listening.